Hi, it's Julie from the PMFRC. I am the Programs Manager, and I am here to welcome you for number 3 of our Fireside Chat series. Fireside Chat is something that we introduced at the beginning of our social distancing measures, and it's our way of reaching out and staying in touch with our families. I don't know about y'all of you, but we have missed going out. Myself and the team, we all really miss having the opportunity to see our families live, to see what you guys are up to. So we want to make sure that we had a way of keeping in touch with you. Each week, we are going to focus on a different PMFRC program, let you know some of the programs and services that are still available, even though you're not seeing us inside of our doors. And letting you know how to reach us. We are also taking the opportunity to reach out to some of our community partners and let you know what's going on a broader scale. So I want to introduce you to some of the folks that we have joining us today. We have Olga Racine. Olga is the clinical manager of the PMFRC. We have Chris Quigley. Chris is our family advocacy coordinator. And for those of you who are familiar with Petawawa, you know Chris. Kevin Strachan is from Garrison, Petawawa. He works in health promotions. He's going to talk about some of the programs that they have available. And then finally, we have Stephanie Adams. Stephanie Adams works for the Family Information Line. And we have been talking on a number of our fireside chats about the Family Information Line and encouraging people to reach out. So we really wanted to invite someone from the Family Information Line into the call and let her talk about some of the services that are available and allow you to ask questions if you have that. So let's just start off. Olga, the doors are closed. We've had questions from a number of people about mental health services and what's available for families who may need a little bit of support at this time.
Well, we continue to offer mental health services. We continue to do intake, and Chris basically doing the intake for people who are reaching out and looking for services. She also coordinates the traffic. If people need to have just a quick session, one single session, or if people need to get more regular services, regular counseling. We're doing quite a bit of counseling sessions with clients who already work with our counselors before this COVID-19 come. And we continue to reach out to see if people need support, need additional help. Just to let everybody know that we're starting to use OTN system. It's Ontario Telehealth Network system that's available through PMFRC, and we're able to utilize this quite a bit. Again, to find more information about it, please contact Chris. It's very helpful and very useful tools that we're able to offer to our clients.
You talked about single sessions. I just want to clarify for those of you who may not be sort of familiar with the concept, that would be similar to what someone would get if they came to one of our walk-in clinics, correct?
Correct. It's just, we try to put, even though we're not offering a walk-in clinic face-to-face, we're still able to offer sessions for clients who need assistance, need support, need guidelines during this difficult time.
Chris, for those of people who are in Petawawa, oftentimes when people are looking for assistance, they say, call Chris Quigley. She's the go-to person. You're not in the office right now. How can people get a hold of you if they want mental health support? How do they get a hold of you to start that process going?
Hi, Julie, and thanks. Yeah, I'm definitely not in the office because we are all social distancing. So I want folks to know that they can still call my office number. That's 613-687-2104. And my extension is 224. And I check that on a regular ongoing basis daily, Monday to Friday. And if they happen to get my voicemail, which they will, it is fairly long, sorry about that, but it also gives contact information for silent hours and holiday hours if they can't get a hold of me. And those numbers are, of course, the Family Information Line. And I'll let Stephanie share what that is when it's her chatting time. The Canadian Armed Forces Member Assistance Program It's 1-800-268-7708. And during the day, we also have opportunities for folks to connect with the Padre Help Desk. So if you need support and you can't get a hold of me and you're waiting on me, you're more than welcome to connect with the Padre. That number is 613-687-5511. And during the day, the help desk is 5434. And the Padres are there from 9 to 3 to support that phone. And then during the evening and silent hours and weekends, it's 687-5511, and the extension is 5611 for the duty Padre. And sorry, Jules.
Go ahead.
If you're an email person, my email address is ciw.pmfrc@belnet.ca. And that is the probably the quickest connection because I am near my computer for my workday, and that goes from anywhere from 8 to 4, but sometimes crisis doesn't sleep, right? So I may be dealing with something past 4. So if I am not responding to you that day, because sometimes people will email me on the weekends or after 4, then please know that I will absolutely reach out the following business day.
Last week when we were talking about childcare, we had one of the duty Padres join us, and she talked about some of the services that were available and how duty Padres can support your family. So if you're interested in learning more about the duty Padre, go back to last week's session. It's still on Facebook. You can look at that. A couple of quick things that I want to clarify with Chris. I know a lot of people, when they call and they get voicemail, they don't want to leave a message because they feel like they're bothering people. Leave a message, right?
Absolutely. Please leave a message, because otherwise I won't know that you've called, for starters. And the other piece is, if you are leaving a message, please be clear with your phone number. I can ask what your name is once I connect with you, but if your phone number isn't clear, if you're using your cell phone and you're in a dead zone or something like that, and if I'm not getting back to you, it's because I wasn't able to hear your phone number. So please, please, please connect with me if you haven't heard from me within a day, because chances are there might be something I missed with a number or a name.
I think one of the things that we've talked about so many times in these sessions, and I'm sure our other guests are going to reiterate that, don't be afraid to ask. If you're not sure if you're asking the right person, reach out and ask anyway. We may not be the right person, but we would rather hear from you and point you in the right direction than have you not know the information. Olga, before we move on, I just want to clarify, mental health services, it's for military families, and you can support adults and children and teens and couples and families, correct?
Correct.
Yes.
Perfect. Kevin, thank you for joining us. Kevin's with Health Promotions, and one of the things that I know when I first moved here that I was surprised to find out is that health promotion sessions are available for military family members. It's not just for military members. And I know that since this has happened and since quarantine has started and we've moved out, that the health promotions team has done a lot of work in virtual programs. Can you want to talk about some of the virtual programs that are available and some of the how people can find out about those?
Definitely, Julie. Thanks for having me. So right now we are focusing on the virtual webinars, and they're taking place right across the country. Am I still here?
You're still there. You're frozen, but we can still hear you.
Okay, sorry. So we have our range of programs that are still available. We have our four core program areas. So addictions, awareness and prevention, injury prevention, nutritional wellness, and social wellness. So those are all still happening. It's a little bit different. We like to be in the classroom, and that's where we work best, but we have to take what's available to us. So people are signing up for these courses. They are still learning the concepts and hopefully taking something away from them. I'm not sure how soon we will be back in the classroom and what that will actually look like. Typically our courses have between 12 and 20 people, and that might be reduced to 5 or 6 if we're to employ physical distancing, but we'll take one step at a time for sure.
So Health Promotions has a Facebook page and you are sharing information. So we are going to share that information. We're going to put the link down for the Health Promotions Facebook page, so you can check that out. If people have questions about the sessions or want to sign up for something, how would they go about doing that?
One of the things that we do is check our Facebook page. So our Facebook page shows what the courses are for the week, and you can access it through there, or that's probably the best way to access.
There have been some really great nutrition seminars that I've taken a look at, and I think there was one on meal planning, and I'm like, I've been talking about meal planning for a long time. This may be finally my opportunity to get myself organized and get that done. So check those sessions out. I know that a number of, I think that Military Family Services Facebook page shares at the beginning of every week, things that are happening across the country all week long. So we will make sure to share those as well and make sure that you guys have those resources that you can take advantage of them. Stephanie, thank you for joining us. Oh, sorry, Kevin.
I just want to reiterate that all our courses, yes, they're for military personnel, but it's just as important for the partner or spouse that's not in the military. If we're thinking about stress management or communication, the partner is just as important, right? So definitely sign up for those courses. We have lots of spouses, lots of partners taking courses, and that's what strengthens the relationship. So definitely sign up for them.
Absolutely. Those resources are available. Let's take advantage of them, especially now that we have time to sort of do a course. So Stephanie, you are joining us about the Family Information Line. Thank you so much for taking the time to tell us a little bit more about the service. I'm just going to leave it to you to talk about the Family Information Line and the kinds of services that you provide and how family can get support from you guys.
Thank you for inviting me. So first of all, on the Family Information Line, yes, we do offer like ongoing emotional support. So it's kind of like counseling, venting sessions. So you can sign up to have one-on-one session with a counselor, and you can have like 8 to 12 sessions an hour each. So it always depends on you, but we're also a place where people can call when they don't know where to start. So if you want, for example, to reach out the Padre and you don't know where to start, we do have all those information, the CISIV phone number. We have a lot of contact, and right now we work a lot on like our outreach. So we do have a Family Information Line's Facebook page, and we're doing like some quick small video, 30 seconds video of like answering like why should you call the Family Information Line, and we're just doing a lot of outreach, and just people, if they're just worried or stressed, they can always call our line.
We will make sure to share that. Couple of things I just wanted to clarify with you, just to make sure that people are aware of that. Family Information Line is 100% confidential, is it not?
It is. So we don't even ask your real name. If you're just calling to have like a quick reference, I don't even ask like where you're from, your real name or anything. If you want to sign up for the one-on-one counseling, we do ask for a name, but there's a lot of people that they decide to not give their real name. So they just put like gender or something like that, just because they're worried that it will have an impact on like someone's career in the military. And we do ask, what's your relationship with the military? Like, is it your spouse? Is it your kid, your parents? Just, it's easier for the counselor to have a better idea of what's going on. And we just ask the province just to make sure that if I'm saying I'm going to call you at 1 p.m., well, if I'm in Ottawa and it's 1 p.m., it's not the same time in BC. But other than that, everything is confidential. The only time that we do have to break confidentiality if someone is saying that they're gonna hurt themselves or hurt someone else, but that's it.
The other thing that I want to let people know, make sure that they are aware of, is it's bilingual service. So if you are English or French, if you call the Family Information Line, you will get support in the language of your choice, correct?
Yes, exactly. All our counselors are bilingual, and when you're getting matched to counselor, if we do have one that is talking a little bit more in slang, or like is better in English or something like that, we do match the counselor with the good client.
And it's across the country, so no matter where you are, if you're in the middle of a posting and you're starting in one area, when you move there, you can still keep going with the service. And you provide support for every member of the family, so teens and children as well?
Yes, the children, usually we start around like 15, because it's like a specific counseling, but teen too. And you can also, it's not even have to be like a family related. So it can be like your best friend. Like, we're not even asking those kind of information. So you can just say someone really close to me. There's people that are really strict. We are not. So it can be like your grandkid, your best friend, your aunt, or something like that. And like we don't really matter. Like if you need help, we're here to help you and to talk to you.
So back to that message, don't sit there and wait, not sure where you can get resources, call us. For those people who are watching us from Petawawa, you may have noticed on our Facebook page that May is Mental Health Month. And every day we put up a calendar, we've got some challenges going, and we're giving people suggestions of things that they can do to safeguard their mental health and maybe invest a little bit in their well-being. So while I have all of you on the line, I'm going to ask each of you if you can give us a tip or a resource or something that you want to share with mental health. We'll just go around. So I'll start top right-hand corner. I have top left-hand corner. I've got Stephanie. Do you want to give us a tip or a resource that you want to share?
For me, the tip that I could give everyone is like, I do know that most of the people are working like at their place and not in the office. Just make sure to take your break, and like at the end of the day you close your laptop and like you do have your little corner to work, not to mix it, because it's so easy to bring like work during the evening and during the night and overthinking. So just have a spot for your work, take your break, take your lunch, go take a walk, and just try to change your mind, because like it can be really heavy on everyone right now.
It's a great tip. Olga?
Well, I think it's very important to make sure that you be more kind, not only to everybody else around, be kind to yourself, be compassionate, and accepting yourself for who you are. Make sure that you do and spend time to allow yourself to have self-care piece. Again, if you go for a walk, if you don't feel like go for a walk, maybe just go outside, sit on your backyard, enjoy the sunshine, and maybe reconnect with friends and family, even though it's through virtual connection, but still try to be connected, try to stay in touch.
Perfect. Kevin, how about you?
Well, first of all, I have to echo Olga's comments. That's fantastic. Secondly, obviously, I would say take one of our courses. It's a great opportunity to learn and to use that learning. I'm taking a really awesome course right now called The Science of Well-Being at Yale University. And essentially, it's a happiness course. And so what it does, it's looking at the research on happiness. How can you get happier? How can you be happier as a person, as a couple, as a family? And then it introduces ways to implement that happiness. Okay, so fantastic course. It's free. You can sign up through Coursera. Lots of free courses on there. So take this time to learn.
It's a great tip. Chris, do you want to finish us off on that one?
Sure. First, I want to give the tip of the phone number for the Family Information Line. It's 1-800-866-4546. The other piece is I want to remind folks to go back through our PMFRC Facebook page and our CAF Connections website page so that they can have a look at our calendar. There are plenty of tips that we have running for the whole month of May in terms of doing something different, trying something new, whether it's bringing a coffee to a neighbor that you want to drop off on the doorstep, of course, because we can't have social coffees together, but you can still drop one off on a doorstep. And there's all sorts of learning to journal and learning to breathe. And if you check out our YouTube channel at the MFRC, you will see our mental health team is hard at work putting together a few of those little tidbits of new habits to form in terms of our new way of dealing during the pandemic. And if you happen to tag yourself in any of those challenges, please let us know by commenting on the calendar once you go back and find it. And I do believe the link is going to be in this feed, Julie. And there will be a little package of mental well-being package to be given out in June after our month is over. We've been following two hashtags for the month of May, being the month of mental wellness. We want to focus on hashtag get real. So really tell someone how you're feeling. Just don't say, oh, I'm okay, because you don't want to burden somebody. You need to be able to get real and say you're having a not so great day or things aren't going well because you can't see your mom or your family or even your partner who may be deployed at this time. And the other hashtag is hashtag kindness. So be kind, as Olga and Kevin said, to yourself, but it's an uplifting thing for you to just kind of go and run to a neighbor's or run to someone that you haven't seen for a while and drop a little wellness note or a bouquet of flowers, or even just a simple knock on the door and wave. Because there's lots of people out there who are living on their own and wouldn't mind seeing a friendly face waving through the window. I know myself, when the mailman comes and drops the package at the door and he gives a little hit on the door, I'm like, oh, mailman's here, I'm gonna go wave. So just a feel good. Hashtag get real, hashtag feel kindness.
I think my FedEx person is very is getting a little alarmed at how excited I am to see him every day. Here. All of the resources are going to be in the comments. We've got the calendar down there. Check out the YouTube page. I know that we did one of our mental health workers did a meditation recording that was amazing. We're also doing a couple of sessions. We've talked about different topics about life during COVID. I know that the last one it's either coming up or it's just gone up about what it's like to be living alone during these times and some tips. Be patient with yourself. Thank you all so much for joining us. Next Wednesday, we are going to be talking about special needs inclusions programs that are happening at the PMFRC. So be sure to join us next week for that. Thank you all again. Thank you, Stephanie, Kevin, Olga, and Chris. We can end this, I guess, on the hashtag get real and hashtag kindness. Be good to yourself. Try something new and reach out. Don't be shy. Ask the question. If you need help, if you need support, please don't sit there and wait. Reach out and get someone to see what they can do to help you. Thank you all. Have a wonderful day. Thanks for joining us.